envelopes. Ready? Ah. Minutes, and let me know when you need to start. Okay, I'm ready. Alright. Starting now. Okay, hi, my name's Rachel. I'll be your PA for today.
Hi, I'm Debbie.
Okay, so I see here on your chart today that you're coming in for an appointment to talk about starting an exercise program.
Yeah.
Okay, so first, just to get a little background, can you tell me like any experience you've had with exercising or anything like that?
Yeah, so I've struggled with my weight for, probably like 20 years now.
Okay.
I just saw the scale when they measured me here, and I think I've gained, honestly, about 40 pounds since then.
Okay.
So obviously it's not something I'm happy about or comfortable with. But I am starting to, I am heavy and my whole family's heavy, so I'm starting to get a little bit worried about us and our health, and I just kind of want to start making some healthy changes for myself and my whole family. I did try and go to the gym on New Year's Day, but I just was very uncomfortable there.
Okay. Yeah, so like you said about your weight, if we just want to look at this chart real quick, I think it's really helpful. So as of right now, we kind of use BMI. I know a lot of people are get really scared when they see BMI because it's not always the most accurate, but it is a good scale for us to use in order to measure where you are now and hopefully where you are in next months and years. Mm-hmm. So you are 5'5", correct?
Yes.
Yes. Okay, and then so if you see here, you follow to 5'5", and then you go to the weight. So you're at 220. So if you go up here, you are in the BMI of 30 and above. So this is definitely where we really try and encourage patients to start some sort of exercise and diet program. And I see that you are willing to start it, which is a really awesome step. Mm-hmm. So we can definitely today talk about some options for you. And, I can write out a specific prescription for you, hopefully to help you on this journey. And do you have, what is your family like? Do you... are you with anyone? Do you have any children?
It's my husband, and then I have a 10-year-old and a 12-year-old.
Okay. And does your husband exercise at all?
We really all don't do much. The kids are a little bit more into video games than they are sports, so that's tough too. So we're not the most active family now.
Okay. Well, I think it is really important that as part of your family, if you guys all want to try and do this journey together, I'd be more than happy to meet with your husband as well to address any health concerns he might have. I see here that you have high blood pressure and eczema, but it seems that it is pretty well controlled, your high blood pressure.
Yeah, that's been well for a while now.
Okay, that's good. So as of right now, I don't see any significant risk factors for why you couldn't start doing some sort of exercise program. In the past, has there been any sort of exercise that you've enjoyed, like biking, walking, anything like that?
I haven't really done too much. When I did go to the gym that one day, I just felt really uncomfortable in front of everybody. I didn't know how to use the machines. I've never really done that before. Right now, all I do is really just walk to my car and to work or to the grocery store, cleaning the house. And I definitely have noticed getting a lot more winded doing those things. So
okay.
I want to start. I don't know what to do. I don't know how to do it. So I definitely need your help.
Okay. So I think that right now we're definitely going to start slow, try out some things, see what you like. And I definitely, want to follow you and have you come back in a few weeks just to kind of discuss, what we can do. So do you have a gym membership currently?
I don't.
You don't? Okay. Would you be interested in having one? If not, there's no pressure.
Maybe. I just don't know how comfortable. I don't know if I'd want to start with that just because I might be a little uncomfortable in there and then I might not use it. So maybe trying to start something different first.
Okay. Yeah, so for your situation right now, we usually suggest, and I've seen it work really well with my patients, about 150 minutes of exercise a week. This is like moderate intensity, so this can even just be like a brisk walk, anything like that. So I would definitely have you start doing like brisk walks every day. You know, do you currently have a job?
Yeah, I do work, but I could definitely do that with my husband when I get home from work and take the kids along.
Yeah, definitely. Like even just after work, like maybe like if dinner's in the oven or something, just like a 30-minute walk with your family is super effective. And because you have high blood pressure as well, just getting some of this cardiovascular exercise can really decrease your risk for like further cardiovascular events. So I think that it's really important that you do start working on your exercise. And so even if just like 3 or 4 days a week, you can go on this walk with your family about 30 minutes or so, and, you know, try that and see how it works. And maybe after you do the brisk walking, you know, eventually we can work it up to more intense exercises. But for right now, you should definitely just stick with the brisk walk. And I also suggest doing some more exercises that you can do at home. Like there's no need for a gym. If you don't feel comfortable, it's totally fine. So I think that stretching is really important, for sure. Like I would say 2 to 3 times a week. Just, you know, do whatever stretching, like whatever you feel that you need to be stretched, like especially like your legs, your arms. There's plenty of like websites that you can just Google like quick stretching exercises. I would say about 10 to 15 minutes of stretching 3 days a week. You know, you can alternate between like one day I walk, one day I stretch, just doing different things. There's also, you can buy online like resistance bands and, using, you know, books as weights, or there's a lot of different objects I'm sure around your house that you could use as weights. And so as well, so you're going to do the brisk walking about 3 days a week. Then you're going to do stretching, I'd say 2 to 3 days a week for 10 to 15 minutes. And then you can do some like weight exercises along with the stretching, I would say. So with this weight exercises, just anything that can get like your heart rate moving and starting to like, you know, build some of that muscle tone in your body is really important. And so even like with the resistance band, like I said, they're pretty cheap. You can probably find them at Walmart or something like that. And just like doing certain exercises, like stretching the band out, or putting it like wrapping on your legs and doing that. It's going to be stretching as well as weight. And then you can use books, and you know, there's plenty of resources. Like even if you have Pinterest, just looking up like simple exercises to do at home is often really helpful. And I would say like start small, use a small book and do like 10 reps of, you know, just pushing it over your head and seeing what you are most comfortable with. And, you know, a lot of patients ask, how do I know if I'm not doing enough or, you know, doing too much? And so we kind of like to use this breathing test where if you can have a conversation like we're having right now and you're not short of breath at all, then you probably could do a little more. And if it's at a point where you can't speak or you're struggling to speak, then you should probably slow it down, especially because you are new to exercising. I would suggest keeping it slow for a little bit, you know, doing your walks, trying to lift weights and see how it goes for you. And then from there, we can alternate the program and, you know, see where we can go from there. I mean, even just any sort of exercise can also be really good for your blood pressure. It's good stress relief. Do you have any problems with sleeping at all?
I don't sleep great, but nothing very unusual. It's every so often I don't have an awesome night of sleep, but not really too many complaints.
Yeah, so sleep is actually like a big risk factor for gaining weight and other sorts of things, and it can be caused from stress, and you know, all of them kind of correlate between stress, sleep, and weight gain. And so my suggestion is, you know, trying to get your 7 to 8 hours of sleep for your age is really important. And you know, if you're having like stressors or whatever in your life, you know, we can definitely like talk about that. Like, do you feel stressed at all about life?
It's just the weight is really starting to get to me now that it's getting a little more difficult to do things like walk around the grocery store and things like that. So that's really been what's on my mind most frequently. But what you've been saying has definitely made me feel a little bit that I don't need to go to the gym. I can start doing this with my family, and it seems a little like I'll be a little more comfortable starting out with that.
Yeah, and I think the most important thing too, as well as someone who's just starting, is to not get frustrated by, maybe the lack of weight loss. This isn't something that is gonna, next week you're gonna be 10 pounds lighter. It's gonna take, we suggest an average weight loss of a pound a week. And that it should be really no more than that. And so, this is going to be something that is life-changing. It's going to take a long time. And it is really important to stick to it. So if there's times where you aren't comfortable with what you're exercising with, you want to change, let me know, or, maybe talk to your husband about it, because this is something that's going to be, a consistent thing in your life. And then hopefully we can work it up and you'll be able to see, some significant changes. And I think another important part of losing weight as well as exercise is your diet. And, we can definitely talk about that, refer you to a nutritionist or a dietitian, but, also with your risk factor of hypertension or high blood pressure, it's really important to, have that balance of eating healthy as well as exercising. But I think that exercise is a great step because it does decrease your risk for, heart attack. It can improve your blood pressure, relieve your stress. It can even help you sleep at night. And so I just think it's really important. Do you have any concerns about having enough time to do all of this?
I'm more, I think the walks a great idea. And I should be able to fit them in.
Okay, good job.